Now joining us in the studio is Josh Michaud, Associate Director of Global Health Policy with the Kaiser Family Foundation. Mr. Michaud, welcome to the show.
Thank you.
Also joining us live via Skype from Kent, Ohio, is Dr. Tara Smith, Associate Professor of Epidemiology at Kent State University. Dr. Smith, welcome to the show.
Thank you for having me.
Let me ask you first, Josh, the President of the U.S. has asked for $1.8 billion in funding to fight Zika. What is the role that the U.S. will play in this outbreak, looking at the fact that there are 50 reported cases so far by the CDC in the United States, but more, of course, in other countries?
That's right. The request from the President for $1.8 billion is mainly focused on the domestic response. So much of that funding would go to states to bolster their mosquito control, their lab and surveillance work to detect Zika, plus public education campaigns. But part of that money will be dedicated towards an international response, doing many of the same things, bolstering lab and surveillance network, doing some of the research that you mentioned, as well as working on prevention tools. And this request comes on the heels, as you may remember, 2 years ago, of a similar request for $5.4 billion for a response to the Ebola virus. And there are some funds still unspent from that request. And as part of this request, the Zika request, they're asking for some flexibility to redirect some of those funds to the Zika crisis.
Now, Dr. Smith, when we look at what is happening now, some people truly feel like there is no need to panic. This is being exaggerated. What do you think? How do you respond?
Well, I don't think there's a need to panic, but I think there is a need definitely to pay attention to control measures and to implement education within the population. There's definitely something going on, and we're trying to figure out exactly what the scope of the outbreak of microcephaly and potentially other neurological issues are in these affected countries and how Zika relates to those.
Now, Zika was discovered in 1947 in Uganda, but there were no known report cases of microcephaly linked to this virus. Dr. Smith, what can you tell us about this time around? What is different?
Right. Well, this outbreak is much larger than ones we've seen previously. And looking back even at the outbreak in French Polynesia in 2013, some preliminary suggestions of a retrospective analysis have suggested that there may have been a microcephaly spike associated with that, or at least an increase that just wasn't caught at the time because it wasn't being looked for. So we really don't know how common this potential outcome of Zika infection is.
Okay. And Josh, I will get your reaction to that. But first, I would like the both of you to listen to this soundbite that we have. VOA spoke to Mr. Julius Lutwana, a virologist at the Uganda Virus Research Institute in Entebbe, Uganda. And when asked if he thought that the virus traveled from Uganda, this is what he had to say.
No, I don't think that is true. It is not true that the virus has traveled from Uganda, because the virus is not only in Uganda. While it was first identified in Uganda, it is spread over a wide area in sub-Saharan Africa and also in Asia. So there is the probability that it may have come from Asia, or it may have come from any other country in Africa where there is Zika virus. In 2007, there was an outbreak in Polynesia, and then I think it is from that area that it has moved towards Brazil.
So, Josh, how do you react to that?
Well, I think the point is a good one, that even though the virus was detected in Uganda in the first place, that doesn't mean that it wasn't elsewhere in Africa and in other continents as well. What we do know now is that it seems to have migrated over time, not knowing exactly where the migration occurred at what time, but it has migrated across the Pacific and now into Latin America.
And Dr. Smith, what is your reaction?
Right, I would tend to agree. The outbreak that we're seeing currently is from an Asian strain of Zika virus, so that has probably been circulating in Asian countries for a while.
Now, quickly, there's another condition that was mentioned in this. It's a Guillain-Barré syndrome, and they're still investigating this. What can you tell us about it, Dr. Smith?
Yeah, so this is another neurological condition. It can cause paralysis, can be temporary, or in some cases can be permanent. In worst cases, it can cause death. So this is something that is seen not infrequently and associated with infections such as Campylobacter or influenza virus. So there is a potential that Zika could be causing that too. They're also looking at other neurologic issues, even in babies, besides microcephaly, that Zika may be associated with. So they're looking at a very broad range of potential neurological complications in addition to microcephaly.
Okay, and Josh, Brazil has seen many cases of microcephaly. Colombia has seen some cases as well, and other countries. So what's going on in Brazil that is different?
Well, actually, Colombia has not seen any Zika-related microcephaly cases.
Yes.
The thought is right now that it was a matter of timing. If this link is true between Zika infection during pregnancy and microcephaly, then Brazil, because the virus was introduced there earlier than in other locations like Colombia, that you see now the outcomes of those pregnancies of women who were infected while they were pregnant in Brazil. We do know that there are many women in Colombia currently pregnant and infected with Zika. Whether or not their babies or a proportion of those babies will be born with microcephaly is still unknown. And it might be a matter of timing.
Okay, perhaps a matter of timing. Quickly, Dr. Smith, one final word?
Just beware of mosquitoes.
Okay, and that's a good way to end this. Josh, thank you so much for joining us. Dr. Tara Smith, thanks for joining us from Kent.
Thank you.
And that was Josh Michaud. He's Associate Director of Global Health Policy with the Kaiser Family Foundation, and Dr. Tara Smith, Associate Professor of Epidemiology at Kent State University. That's our Africa 54 Health Report for today. Vincent?